If you've been struggling to conceive for more than 6 months, or maybe you've just gone through a heart-wrenching miscarriage or chemical pregnancy, then you are probably going to want to look at your egg quality. Now, wherever you are on this journey, I want you to know that it's so normal to feel what you're feeling right now. Frustrated that something might be wrong with your body, worried that your eggs may be too old, or just guilty for waiting too long in order to get pregnant. I want you to know that it's okay. Your body is not broken. There is a way through this, and nearly every single one of my clients feels this way at some point in their journey. That being said, you're probably still wondering how to know if your egg quality is good enough. So let's dive in, because you are going to get massive clarity on the status of your egg quality so that you can make empowered decisions going forward in your fertility journey. Hi, welcome back. My name is Stesha, and if you're new here, I am the creator of the revolutionary program, Holistic Fertility Method, where women everywhere are healing their mind, body, soul in order to conceive their baby naturally and become their next level version of themselves. So if that sounds like something you want to be a part of, go ahead and hit the subscribe button and join the movement. Today we're talking about egg quality and how to know if your egg quality is good enough in order to get pregnant naturally. Now, here's an important thing to realize. There's no test to measure egg quality, meaning you can't just show up to your doctor and expect her to run a lab test and be shown exactly what your egg quality status is. But that doesn't mean there aren't other ways to indirectly figure out how your egg quality is doing. I'm going to show you 2 of those ways today, and definitely stick around for the second one because it's the most doable and something that you can get started right away. The first option is not something that I recommend, but is probably the only thing that your doctor will recommend. And that is this: retrieving your eggs through an IVF process and fertilizing them in a lab in order to see which embryos made it to the blastocyte phase and which did not. From there, your doctor is going to give you a rating on how good your egg quality is. Now, there's nothing wrong with this method per se if you have a lot of time to waste at appointments and money for these expensive procedures and a mindset of steel in order to handle all of the emotional ups and downs through the process. But if you knew that there was a simple, less invasive, less expensive way in order to figure out the quality of your eggs, my guess is that you'd probably look into it. And that's exactly why I'm going to be sharing that with you today, so that you have the knowledge and the power in order to get these tests run without having to jump into those invasive procedures if you don't need to. The second way that you can determine your egg quality indirectly is by looking at your systemic inflammation. Now, we hear a lot about inflammation being bad, but the thing is, acute inflammation is necessary for cellular repair during things like ovulation and menstruation, implantation, and birth. However, it's the excess chronic inflammation that is the root cause of many reproductive disorders that we see today. Things like endometriosis, PCOS, pelvic inflammatory disease, premature ovarian syndrome, uterine fibroids, follicular cysts, hormone imbalances, and menstrual irregularities, and poor egg and sperm quality. The biggest way that inflammation is causing all of this damage is through runaway oxidative stress. When we have a large amount of environmental factors coming into the body that are triggering inflammation, along with poor nutrient sufficiency and a genetic predisposition to inflammation, we have this perfect storm of reactive oxygen species systemic in the body that are causing a lot of damage to the cell membranes and DNA. If you want to know more on how to eliminate your exposure to these environmental toxins, along with how to increase your nutrient density, be sure to watch my next video, which is 8 steps to radically increase your egg quality. But before you go, I want to show you the main tests of inflammation that you can go get right now from your doctor or from a third-party lab that will show you what your systemic inflammation is doing and if it is a cause to your poor egg quality. Now, it's important to know that these tests can't tell you what is causing the inflammation, but it can definitely point you in the right direction to seek help on how to quench that inflammation in your body, starting with a gut health protocol, liver detoxification, an overall supplement protocol to move your body back into balance. And these tests can also be used as a marker of progress when you are working on such a protocol. The first marker that you see is a general look at your systemic inflammation. So if this marker is high, you know that inflammation is an issue that needs to be addressed right away. The next marker, ESR, is a sediment rate of your erythrocytes, again, looking at the inflammation in your body. The next test is a group of cytokines that measure the initiation and mediation of inflammatory processes in your body. So if these markers are high as well, it can tell you which parts of the immune system are being activated, what are chronic, what are acute, and you can go from there in terms of your treatment protocol. And then finally, a CBC differential, which is just looking at your blood count. If you notice that monocytes and lymphocytes are on the high end, that can also mean that there is a chronic inflammatory reaction happening and your immune system is being activated. Now, if you suspect that inflammation is at the root of your poor egg quality and inability to conceive naturally, be sure to reach out so you can know what it's like to work with us inside of Holistic Fertility Method so that we can get to the root of your inflammation, heal your body, increase your egg quality naturally, and conceive your baby in the way that you desire. All right, I'll see you next time.